Okay, so this class is about the cardiovascular system. So you guys know that the cardiovascular system has three components: the heart, the blood vessels, and the blood. The heart is a hollow organ that is located between the lungs and is the one in charge of pumping blood through the blood vessels. The blood will provide oxygen and nutrients to the organs and will remove metabolic waste. We have two major circulations: the systemic circulation and the pulmonary circulation. Do you know which one has venous blood and which one has arterial blood? Someone wants to answer?
Teacher, can you repeat the question, please?
Which circulation carries arterial blood and which circulation carries venous blood?
Systemic circulation carries the arterial blood.
Okay, very good. And the venous blood is carried by the pulmonary circulation. Then we can talk about the pericardial sac that has two layers: the outer layer that is called parietal layer, and then the visceral layer that is the inner layer. Generally, there's a small quantity of fluid that helps the layers not to stick. But when there's an infection or an inflammation, a pericarditis, there can be a pericardial effusion when there's more quantity of fluid. This can cause the heart difficulty to pump. Okay. Then we talk about the heart walls. You have the epicardium, the myocardium, that is the thickest layer, and the endocardium. And it's the circulation of the heart is given by the coronary artery. Then we can talk about the chambers of the heart. Do you remember which are the receiving chambers? The upper or lower chambers? Who wants to tell me?
The upper?
Yes. So the upper chambers, they're called the atrium. That's in singular form. And in plural, it's the atria. Okay. And the receiving and the pumping chambers are the ventricles. Remember from the video which ventricle has the thickest layer? The left or the right ventricle?
The right.
Left.
The left, yeah, the left, that carries the systemic circulation. No, it carries the arterial blood, has the thickest layer. Then we can talk about the vena cava, the pulmonary arteries, and what else? And the septum. No, you have the atrial septum and the intraventricular septum. And then this is the practice test that we did. Remember that the electrical activity from the heart starts from the sinus node and then goes to the AV node, and then we'll divide and go to the bundle of His and divide into two branches. And from these branches, you're going to have the Purkinje fibers that go into the endocardium. And the EKG, you represent each part of the EKG with, remember, the P wave is the depolarization of the atria. The QRS complex is the depolarization of the ventricle. And the T wave is the repolarization. And the U wave that we didn't see in the video is the repolarization of the atria. Then we talked about the PR interval, that is the time between the sinus node and the AV node. When the PR interval is prolonged, what happened into the heart? Do you remember? There was an arrhythmia. You have the AV block, no? for the AV block that there's different types of decrease, you have to put a pacemaker. And something that in the video they didn't talk about is the ST segment. So when there's an elevation of the ST segment, we talk about myocardial infarction. It's stemming, ST, like ST elevation, myocardial infarction. Okay, then blood flow. You know this from anatomy. The right atrium receives the oxygen pore or the deoxygenated blood from all the tissues except the lungs, and they go through the superior and inferior vena cava. And the right ventricle pumps this venous blood to the pulmonary artery that goes into the lungs. And then the left atrium receives the oxygenated blood that goes through the 4 pulmonary veins, and then it goes to the left ventricle that pumps the blood through the aorta. What I forgot here is to talk about the valve. Do you remember which one has, which is the mitral valve? Is it the left heart or the right heart?
Right.
The right heart.
Yes. No, the mitral valve is from the left heart. It's the bicuspid valve. And the tricuspid valve is from the right heart. Okay. And then we can talk about some pathology of the cardiovascular system, about atherosclerosis, when there is a narrowing of the arteries, of the lumen of the arteries, that is caused by the cholesterol plaque. Do you know what foods are rich in cholesterol? Does someone want to give an example?
Red meat.
Junk food. Junk food.
Junk food, yes, okay, yes. All these French fries and everything that is deep fried, that is rich in cholesterol. And that cholesterol goes to your arteries and it will block them. It will cause the lumen of the artery to be narrow. So there's going to be a decreased blood flow, and this can cause ischemia, no? This cholesterol plaque is called atheroma. So the symptoms are going to depend on where you get this, you have this atherosclerosis. So for example, if it's in the heart, this can cause an angina. If it's in the brain, it's low blood flow will cause a stroke. If it's in the limbs, in the lower limbs, it's going to cause peripheral vascular disease, and clinically, the patient will have intermittent claudication. So this consists that when the patient walks, he feels a lot of pain. Yeah. Okay. So I think you did this in last year. Did you talk about CPR? Yes. Yes. Did you talk about CPR? About basic life support? What to do when a patient has a heart attack? Yes, you did this in Instrucción Médica. You talked about this.
No yet.
Oh, not yet? Ah, no, sorry. Okay, well, you're going to talk about this soon. So when a patient has a heart attack, when he falls, passes out, you have to do a cardiopulmonary resuscitation. That is called CPR. Before, the algorithm was ABC, because it was first, you had to evaluate the airway, then give rescue breathing, and then compression. But since 2015, what you prioritize in the CPR is the compression, the chest compression. That's very important. Then you have to evaluate the airway, especially You have to see if the tongue is not going down, backwards. And then you have to, if you can try to give rescue breathing, okay? And this is how you try to defibrillate the patient, make his heart go again with the external defibrillator. Okay. Have you seen this before? This image? This machine? Somewhere?
EKG machine.
EKG? No, it has an EKG because it can read it.
This fibrillator.
But this one, defibrillator. Where do you see this commonly?
In emergency in the hospital.
Very good. In emergency rooms, but also where there's a lot of people, there should be always a defibrillator. For example, in not airplanes, in, I forgot the word.
In ambulances.
In a cardival.
Ambulances, very good. No, but in other places that are for example,
Airport?
in stadiums. Airport, yes, thank you. I was thinking of airplane. Okay.
In a carnival
In the
with
airport. Where else?
in carnival, in games of montaña rusa. I don't know.
Yes, in all those games, yes, when there's a lot of people, there should be legally defibrillator there. Okay.
In an
Then
ICU unit.
Yes, in an ICU, of course. In the hospital, of course, but like in outside the hospital, also it's important. So some vocabulary that you already know. EKG and ECG, that we talked about the representation of the electrical activity of the heart. Then diastole, that is the phases of the heart cycle. Diastole is when it relaxes. Also, it's important in the diastolic phase. That's when the heart gets its irrigation from the coronary arteries. That's important. Then the systole, that's the contraction of the heart when the blood flow, or when it's going to pump all the blood to the organs and to the extremities. Asystole, when there's an absence of a heartbeat. So how do you think the asystole is going to be represented in an EKG?
As a straight line.
Very good, like a flat line, no? Then intermittent claudication, what I was telling you about the muscle pain during exercise. This is typical when there's atherosclerosis in the limbs, in the arteries of the limb. Then avascular, when there's no blood vessels. And cardiology, well, the field that studies the heart, no? Congenital diseases, coronary artery disease, heart failure. Do some of you want to be a cardiologist? No? Have you thought about the specialty you want to do when you finish med school? No? Okay. Then vascular surgery, you can think of a lot of options. For example, I'm an endocrinologist. Since I started med school, I wanted to be an endocrinologist. Do you know what the endocrine system studies?
It's related about the physiology of hormones.
Of hormones, very good. Yes. So, what type of patients do endocrinologists see? That is very related to, I don't know, cardiology.
Teens.
No, yes, usually diabetic patients. Very good. So patients with diabetes, I have a lot of cardiologists that are my friends because we share a lot of patients. Most of the diabetic patients have coronary artery disease, and they don't usually have the typical symptoms of chest pain. that what I was telling you in practice class, it's very typical for these types of patients to have pain, but they have like a belly pain and a lot of nausea because the myocardial infarction that they usually have is in the inferior surface of the heart. It's touching like the diaphragm, so they don't have that typical heart pain. Okay, well, just a parenthesis. Then we were talking about vascular surgery and aneurysms, for example, that are localized dilations of the blood vessels, and the pacemaker, that would be the treatment for AV blocks. Then we can talk about the lymphatic and the immune system. So unlike the cardiovascular system, the lymphatic system does not have a heart. So instead, the lymph has to go back using the nearby muscles and blood vessels to help to aid his flow. Okay, and you also have the lymph nodes. Remember the function of the lymphatic system. Basically, it helps to absorb lipids and lipid vitamins, then remove the waste from tissues, and also it's related to the immune system. You have different lymph nodes localized, for example, in the cervical region, in the axillary region, in the inguinal region, that they get swollen up when someone has an inflammation or an infection. Then we can talk about the lymphatic circulation. Remember that the right lymphatic duct is going to collect all the lymph from the right side, and it's going to empty into the right subclavian vein. And the thoracic duct is going to collect all the lymph from the left side of the body, and it's going to empty into the left subclavian vein. And these, they're going to empty into the superior vena cava. Then you have the specialized lymph organs, the tonsils, the thymus, and the Peyer's patches that are located in the small intestine, basically in the ileum. You have the spleen and the lymph nodes that we already talked about. Then lymphedema, for example, that's a pathology of the lymphatic system that is characterized by swelling because there's an abnormal circulation or accumulation of the lymph fluid. The most common cause are secondary causes related to cancer treatment, surgeries, or chemotherapy. The primary cause, this is not very common. This is mostly due to a malformation of the lymphatic system. And that's it. Some vocabulary mostly related to the immune system, pathogens, allergens, toxins, malignant cells, the immunoglobulins that you already know, vaccinations, and lymphadenopathy. And you have questions that you can try to do because some of them can be in the test. And that's it. Nothing else. Do you have any questions? No? Okay, so before we go, I wanted to, bueno, mejor hablemos un poquito en español. Hay algunos alumnos que se están retirando que no hay problema, pero prefiero que se retiren si es un poco, o sea, si es aburrido o feo o es difícil, pero no por cruces de horario, porque en eso parte es la mala coordinación que yo he tenido. Entonces, el próximo mes yo creo que sí ya podemos tener horarios más decentes para que no les afecte mucho. Y igual si tienen algún cruce, me pueden avisar. O sea, las clases siempre están en el Blackboard y para las prácticas, pues podemos hacer prácticas también de uno en uno, eso no hay problema, ¿ya? Y pueden presentar trabajos o lo que las presentaciones las pueden hacer pues entre 2, entre 3, eso no hay problema. En eso podemos apoyar, ¿no? si se retiran, por eso les digo que sea porque está feo el curso, pero no por lo del horario. ¿Ya? ¿Alguna? Entonces en noviembre voy a intentar ya tener horarios decentes. ¿Alguna pregunta? ¿Alguien quiere comentar algo? ¿No? Ya. Entonces vayan y me quedo con los chicos de las prácticas.